So cellulite is caused by little collagen bands that pucker the skin. The skin is overlying the fatty layer of your body, which is covering your whole body from scalp to toes. Different areas have different layers of fat, different thicknesses of fat, but ultimately, when there are support bands that are shortened or are tight, or areas of prior trauma where you have a little pucker, in the buttocks, there's a lot of support structures because we sit on that, right? That's a stronger tissue. We use it to sit. So the buttocks fat is denser and the support bands are denser. Then as you're aging, and if you gain weight and age, like so many of us do, then when the fat is larger, the bands supporting it create a pucker because they're pulling it back, almost like buttons on a quilt, pulling it back, right? You can imagine those little quilt buttons. So those support bands can create a texture that really creates a lot of lumpiness in appearance. So those little puckered spots, if you come in and we're planning surgery, this can be done awake or asleep. We'll mark each of those puckers. We typically only will treat about 30 per session, maybe 40. We'll mark each little pucker while standing so that we can see them. We can use a shadow light to accentuate it so it's really clear. We both see it. We mark all of them. Then we go to surgery, either with light sedation or completely asleep, using something sedative like you would have for a colonoscopy, little propofol, where you're breathing for yourself, but you're resting, laying down. We numb the area, then we create a little tiny opening with a needle. This little device sneaks underneath that numb tissue and then finds that band holding it back. Then we use this little tester and find the band, pull the band, and we'll see that little pucker move in the skin if we're on the correct band. And then when we're ready, we pull the trigger. Snip, snip, and that will cut just that band so that pop, the little hail dents come out. We treat them one at a time. Each little hail dent treated, and this light helps us see where it is under the skin. So we sneak to the right area, about 1 centimeter under the skin, deploy the band, test it, pucker, pucker, we got the right one, snip, next, and we go pucker to pucker until they're all smoothed out. Sometimes I like to do a little bit of liposuction, maybe some flank fat or inner thigh fat. I'll take that living tissue, wash it, filter it, and then use it as an injection to help those hail dents get a little more volume, to pop them out and help them be even smoother if we need to. That just depends on the situation and your goals. That's not a big BBL, it's more like just a little spackle here and there as needed to get a smooth result. It's nice, it works, and it's safe.